right, everybody. Thank you for joining in this morning. I have 11:04 on my time, so we'll go ahead and get started. This is Katie Beckett Program 101 training presented by the Tennessee Justice Center and Family Voices of Tennessee. Just a few things before we get started on the training this morning. The webinar will be about an hour long, and we ask that you please use the chat or Q&A feature to ask questions. You can ask them throughout our presentation. We do want to say, though, at the top that this is a brand new program, and so there's a lot to this program that that we're finding out about as we go along, and so we will try to answer all the questions that we are able to. And time permitting, hopefully we'll be able to answer some questions at the end of the presentation. Any unanswered questions that we have an answer to, we'll be able to send out in a follow-up email. But just ask that you have patience and an understanding that this is a brand new program that we're all learning about as we go. And the slides will be distributed to all attendees by close of business tomorrow. That's the goal. So thank you all again for joining. And today we have two presenters. My name is Katie Ann Twiggs. I am at the Tennessee Justice Center. I work as the Community Engagement Coordinator for the Independence Team, which is Tennessee Justice Center's team that works on advocacy issues for older adults and adults with disabilities. And I know that the Katie Beckett program is actually for children, but it's a type of long-term care insurance through Medicaid. And so that's sort of why it's under my umbrella. And then after I present, Sarah Scott with Family Voices of Tennessee will be covering the latter part of the presentation. And hopefully, like I said, we'll have time for some question and answers near the end of the presentation. So I just wanted to start off with what is the Katie Beckett waiver program. The Katie Beckett program is for children under the age of 18 with disabilities or complex medical needs. These children would otherwise not qualify for Medicaid because their parents' income or resources are over the allowable Medicaid limit. So Medicaid has strict limits as far as how much income or how many assets or resources an individual can have. And so a lot of times families who have children with complex medical needs, need a lot of help with paying for those medical expenses, but are over those strict income or resource limits. And so Katie Beckett is a program that's created so that these children can still get the help that they need. It helps pay for some of the care that the child needs that private insurance does not cover, and the care is provided in the child's home or community. In the Katie Beckett waiver program, there are three different groups. Katie Beckett Part A is for children who would qualify for institutional care, but want care in the home instead. So this is for children with the most significant needs. These children would qualify for care in a nursing home, hospital, or intermediate care facility for individuals with intellectual disabilities. You'll hear that last category that I mentioned, you'll hear it be called ICF-IID sometimes. So these are children who would qualify for care or who need care in those kinds of institutional settings, but want care in their home and community instead. Part B is for children who are at risk for institutional care. So these children don't qualify for institutional care, but who are at risk of needing institutional care if they don't get any services. And then Katie Beckett Part C is for children who are losing Medicaid because their parents' income and or resources have increased, and they would qualify for Part A, but there are no open slots. So Part C is for children who have Medicaid now, but their Medicaid is ending because their parents' income or resources have gone over that strict Medicaid limit that I mentioned before. Part C may allow the child to keep Medicaid if they would qualify for Part A. So if they meet those institutional level of care standards, and we'll talk more about what that specifically means later on. So Part C, they could continue getting their Medicaid benefits if they medically qualify for Part A, but there are no open slots in Part A. And so I'll tell you more about slots in the next slide. So we're going to go through each part of Katie Beckett and talk about the benefits that are covered in each part of the Katie Beckett waiver. So the slots available in Part A are 300. There's 300 slots reserved for children to be served in Part A. And these children will receive full Medicaid benefits through TennCare Select. They'll get regular meetings with a nurse care manager to plan their care, and up to $15,000 in home and community-based services. So these children in Part A have the most complex medical and behavioral needs and will be served first. Other children who need institutional care will be served after that. And children in Part A will qualify for all Medicaid benefits that are available to children who enroll in Medicaid. So this includes things like doctors and hospital visits, dental care, home health care, in-home nursing services, medical equipment and supplies, occupational therapy, physical therapy, speech therapy, and non-emergency medical transportation. Those are all the kinds of benefits. That's not an extensive list, but those are all the kinds of benefits that a child gets under Medicaid coverage. And these services must be medically necessary, and private insurance must pay first. TennCare is always a secondary payer. TennCare will help pay for those things private insurance doesn't cover, including insurance deductibles and copays. Just to talk a little bit more about the nurse care manager, they'll have this nurse care manager through TennCare Select to help write up a plan of care for each child's needs. The nurse care manager will meet with the family at least quarterly to help the family with the services and planning the services. And they'll meet monthly with children who meet the Tier 1 level of care standards. And I'll talk about Tier 1 level of care versus Tier 2 in later slides. The nurse care manager will also help as needed in between meetings. And then the children in Part A also get these extra home and community-based services to help with their disability. This includes services that help the family meet their child's needs in the home. These are called home and community-based services. You'll also hear them be called HCBS. Unfortunately, there's lots of acronyms in this world. So HCBS is one of those acronyms. It stands for home and community-based services. And the total cost of HCBS for a child in Part A, it can't be more than $15,000 a year. And this is the child's yearly limit. It starts on January 1st each year and ends on December 31st of each year. These extra supports are things like respite care, community transportation, assistive technology, minor home modifications, vehicle modifications, personal attendant care, and again, that list isn't extensive. So for Katie Beckett Part B, there are 2,700 slots available in Katie Beckett Part B, and they will be filled on a sort of first come, first serve basis. The children in Part B won't get full Medicaid coverage, but the child will get services, those home and community-based services to help the family meet the child's needs at home. This includes help paying for the child's insurance, the private insurance a child may have, and the child's needs that the insurance doesn't cover. The total cost of home and community-based services available to a child in Part B is $10,000 a year. So they can receive up to $10,000 a year in those home and community-based services, those sort of extra wraparound services. Children who meet qualifications for Part A, but for which there's no open spot, will be served in Part B as they wait for a Part A slot to open up. As in Part A, the child gets a nurse care manager. The child in Part B will get a case manager, who will be responsible for helping them set up and sort of set up those services and create a service plan, a care plan. Part B can be used to pay the cost of the child's private insurance, as I said before, and it also covers, it also can be used to pay for the care a child's private insurance doesn't cover or only pays part of. So it can include a healthcare account with a card to pay for some of these services as costs happen, or it can also include getting paid back for things you can't purchase with the card. And Part B, that $10,000 limit, like I said, includes, can be used to cover any of the home and community-based services that I described in Part A. Okay, Katie Beckett, Part C benefits. Children in Part C will receive all the Medicaid benefits that are available for children under Medicaid, including periodic early screening, diagnostic, and treatment services. This is called EPSDT. That's another acronym you may hear. But children in Part C will not receive any of the extra home and community-based services that are available in Part A and Part B. So they get full Medicaid, but no extra wraparound home and community-based services. I did want to note, though, that they still have access to some limited kinds of home health services that are available under their regular TennCare coverage. So that includes part-time intermittent nursing services, home health aid services, and private duty nursing if a doctor orders those services. But they would be subject to the caps for those services that are described in the TennCare rules. They just won't be able to get those extra home and community-based services, things like respites, home and vehicle modifications, non-medical community transportations, things like that. They also won't automatically get a regular case manager like they would in Part A or Part B. Part C, they don't have to have any private insurance or pay any premiums. But if a child enrolls in Part C and then a Part A slot opens up, they must move into Part A. They can't stay in Part C anymore. So now I'm moving to medical eligibility for Katie Beckett. An assessment will be completed before enrollment to decide what level of care is needed to meet a child's needs. And there are two levels of care for Katie Beckett. There's the institutional level of care, which is covered in Part A. And then there's an at-risk level of care, which is covered in that Part B. And they break down, you can see on my slides that institutional level of care is split up further into Tier 1 that will serve the children with the most complex medical or behavioral needs. And then Tier 2 is for children still with complex medical, behavioral, or functional needs. In the next slides, I'll break down the specific medical eligibility requirements for Part A and Part B. Remember that Part C medical eligibility is the same as Part A, because Part C is for children who would qualify for Part A, but there's not an open slot. So that's why Part C medical eligibility is not described here, because it's the same as Part A. So institutional level of care, Tier 1, again, this is for Part A. The medical reasons a child might, or the sort of requirements that a child must meet in order to be approved for a Tier 1 Part A approval is they have to have a chronic lifelong medical condition with a high mortality or morbidity rate resulting in severe functional limitations and complex medical needs. And the child requires high healthcare service needs and utilizations. Examples of that are frequent visits to the emergency room, frequent hospitalizations, multiple surgeries, or multiple subspecialists. And the child's condition is not stable, meaning that if they were to go without care, or really at any moment their condition could worsen or be life-threatening. So that's what the state sort of means with not stable, is that the child's condition could quickly deteriorate in a way that would be life-threatening. And the child requires frequent, direct, skilled medical interventions that are performed multiple times during an 8-hour period, and the use of medical equipment to sustain life. The complex medical interventions must include at least one of the following. So the child must be on a ventilator or non-invasive positive pressure ventilations for at least 8 hours a day, tracheostomy care requiring frequent suctioning, oxygen administration for chronic hypoxia requiring at least 8 hours of oxygen a day, total parenteral, I looked up how to say that word before and then I missed it, but total parenteral nutrition or dialysis. So they have to have at least one of those skilled medical interventions to qualify for Tier 1 Part A for a medical reason, right? And so then there are also those children with those needs will be served first as this program has opened up and is accepting new applicants. You can also be approved for a Tier 1 Part A approval if the child has behavioral issues and behavioral needs. So a child could be approved if they meet all of these qualifications. So they have to have a severe or profound deficit in intellectual and or adaptive behavioral functions, which must include a significant communication deficit, or they have autism and a severe or profound communication disorder, and has severe or co-occurring behavioral health support needs that have persisted for at least 6 months, which include dangerous behaviors that place the child or others at imminent and significant risk of serious harm. And the child requires someone with them to be with them all the time, to step in when needed to keep the child or others safe. And the child has already been involved with a crisis mental health system, Department of Children's Services, or the criminal justice system. I wanted to mention some specific behaviors that could qualify a child for Tier 1 when they're talking about dangerous behaviors. In addition to the traditional things we think about when considering dangerous behaviors, things like biting, hitting, cutting, burning, etc. I wanted to mention that life-threatening eating disorders would also count as a dangerous behavioral problem that would place the child at risk of harm. And unwanted sexual contact towards others will also be considered as a behavioral problem placing others at risk of harm. And so although these kinds of things might be really difficult to talk about, especially to an assessor who you don't know, you've never met before, it would be worth reporting them because it could be helpful in getting them a Tier 1 approval. And again, these children in Tier 1 will be served first. All right. Institutional care Tier 2. So these kids are still in Part A, but they are a Tier 2 approval, meaning that they will be served after the Tier 1 children have been enrolled. A child can get approved for a Tier 2 for medical reasons if the child has a chronic medical condition that requires care all the time or most of the time. And this includes certain kinds of daily skilled nursing care, even if their parents provide that care, or intensive therapy. And what they mean by even if the parents provide the care, so maybe the child requires the skilled service of tracheal suctioning, but the parents are able to provide that care. You know, that would still count towards getting them approved for a medical tier 2 approval. And the child requires help throughout the day with activities of daily living, much more than children, much more than other children their own age. So these are called substantial functional limitations. And they have to have substantial functional limitations in at least 2 of these areas: learning, communication, self-care, which includes bathing, grooming, dressing, and toileting and eating, and then mobility. So they have to have, you know, substantial limitations in at least 2. That's more significant than what we would expect from a child their age. So if a child who's 3 needs help with tying their shoe, right, that wouldn't be enough sort of to claim that they have a functional limitation with dressing, because you know, most 3-year-olds can't tie their shoes. So they look at whether it's normal or whether this child's needs are sort of exceptional for their specific age group. So a child can also be approved for a tier 2 part A approval if they have behavioral concerns, and the state is specifically looking for if children have profound deficits in intellectual and or adaptive behavioral functions, which must include significant communication deficits, or has autism and a profound communication disorder. That's the same as in part in tier 1, but a child with behavioral problems in tier 2 have a little less extensive need, or need of less frequent intervention. So they must have a severe co-occurring behavioral health need, which include dangerous behaviors that place the child or others at risk of harm, but they maybe don't need the constant supervision or constant attendant to like they would in tier 1. And the child requires help throughout the day with at least 2 of the areas that we listed before: the learning, communication, self-care, or mobility. A child can also be approved for tier 2 for simply just functional reasons. So if the child has a intellectual or developmental disability and their child requires lots of help throughout the day with all 4 of the activities of daily living that are assessed in this for Katie Beckett, which are the learning, communication, self-care, and mobility. So at risk of level of care, so this is part B. This is the first time we're talking about eligibility, the medical eligibility criteria for part B. These children who meet these qualifications will not be enrolled in part A. They will instead be enrolled in part B, which, remember, comes with a $10,000 worth of those wraparound home and community-based services and no Medicaid enrollment. So a child will be enrolled in part B if, for medical reasons, if they have a chronic medical condition that requires certain types of daily nursing services, again, even if their parents provide that care, or if they require intensive therapy. And the child requires help throughout the day with their activities of daily living, much more than other children their age, again, in at least 1 of the areas that are listed below. And then a child may be approved for part B for behavioral reasons if the child has an intellectual or developmental disability and the child requires help each day with activities of daily living, not all the time, but much more than other children. And now I'm going to pass it off to my colleague who's helping me present, Sarah Scott.
Hello there. We'll switch from talking about medical eligibility to talking about financial eligibility. So there is a little bit of a financial eligibility, even though everyone says that there's no income counted in this program. There technically is. Only the child's income and resources are counted. The family's household income and assets are not deemed, but the child themselves cannot have income more than 300% of the SSI rate and resources of no more than $2,000. There are very few children out there that have income of this size, but there are some. So those are the technical income guidelines. Next slide. So this fancy chart here is about the Part A premiums. I know this is one of the bigger concern areas of a lot of families because they're already paying for a private premium or a private insurance plan. And we're looking for this life raft of Katie Beckett to help them out, not cost them more money. So there are premiums, but as you can see here, they are relatively low. It depends on, this chart shows household size of 2. I'm not sure why they decided to use 2 people in their example, but they did. And I took this right from TenCare. What you want to know here is that if it's above 5% of your household income, it's considered not affordable. And so you have some leeway there. But the important other piece is that I'm going to paste some figures. Well, actually, I'll just share them with you since my button isn't working. 250% of the federal poverty level is around $42,000, and 400% is around $67,000 for 2 people. So, you know, we're talking about a pretty low premium compared to, next slide. This part. Your premiums are going to be reduced by the costs associated with your required private insurance premium. So you might even end up with a wash and have no Part A premium obligation. Some people are definitely going to obviously have some. I know some of you are applying for multiple children even. There is another little known fact that appears in only one document that I have found so far. That is, if a parent is required to buy health insurance for themselves, for the child to be covered, then the parent's portion can also be included in the amount that's going to be deducted from that Part A premium. So it's a bit of a math equation for sure. But I think it's going to be much less money than most families were concerned about. Next slide. One thing to keep in mind is your policy starts on the date that they receive your premium payment, and you are required to pay for 1 month in advance. And they are going to be pretty carefully watching how well those are paid. And they've set up this lovely process here for how they're going to handle non-payment. And they're going to only give you about 10 days advance notice after your premium has been due before they suspend your benefits. They are giving you, though, two full months of missing, though, before you are terminated. And it only says may be disenrolled. So I think we might see in the future what that looks like of how quick they bring that hammer down. But I think these are really important guidelines that people need to keep in mind, because you can re-enroll for Part A at any time. However, you're starting over at the beginning. You don't go right back to a spot. You do have to pay anything that you previously owed, which seems like a bit of a punishment considering that time is already over. and you wouldn't have you would have missed that coverage time. Next slide. So Katie touched on this before, but I wanted to kind of draw it out in a more visual way. Is we're talking about a lot of different wording in this plan, especially with the home and community-based wraparound services, that extra chunk of money that people are trying to use. And for Part A people, that's going to be called a person-centered support plan. And for Part B people, that's going to be called an individual support plan. And they're going to be approved by and spelled out by those two different entities. For Part A, it'll be that TennCare Select MCO, which is Blue Care. And for Part B, it'll be DIDD. So those two different plans really lay out exactly what your services are, the frequency, the duration, and exactly what, where, when, and they won't be paying for services that aren't included in those plans and authorized by these entities. Next slide. One of the other parts that is really cool about these two HCBS features is that you can be reimbursed for other healthcare expenses that would be qualified for reimbursement under maybe most people are familiar with a flexible spending account or a healthcare savings account, and or ones that you would normally use if you're deducting just medical expenses from your income tax. There are still requirements of what's allowed to be considered, but pretty much anything that's on these lists is going to be allowable. Next slide. Here is one of the tricky ones, or the extra is items that are deemed medically necessary but are not eligible for reimbursement. So this is going to be called individualized therapeutic support and reimbursement. And this they came up with really based on family feedback about the things that families were looking for. A few that stick out to me were like horse therapy and water therapy that people really found useful, but weren't typically coverable anywhere. So they've made that allowable in the Katie Beckett program. So you're still going to have to follow the guidelines that everything has to be deemed medically necessary. But otherwise, and thank you. And this is how we're talking about what is medically necessary in this program. And I think there's a couple things in this list that we need to pay close attention to. One of them is it does have to be directly therapeutic or ameliorating your disability or some symptom or feature of your illness. I think everybody is familiar with that part. In all disability programs in Tennessee, you're going to notice a requirement for integration and participation in the community. It's just good practice and kind of, I guess, how we do things in 2020. But something that I think people aren't necessarily familiar with or as used to seeing is the need to prevent the risk of out of the home placement. And that's going to be heavily watched in this program, particularly in your total costs and whether or not it is medically necessary. Another thing that's important that I think folks are unfamiliar with is the last one. They're not going to authorize anything that is going to normally be provided by someone in the household that you normally can get for free in another way. They really want this to be some sort of, you know, TennCare is always the payer of last resort. So you have to have utilized every other resource first. Next slide. So the application process, for those of you who haven't gone through it yet, is pretty straightforward, except it's not. The TennCare Connect website is pretty simple to use. You sign up for yourself an account on TennCare Connect. A lot of families got confused at whether or not they were signing up for their kids or for themselves. And the application is designed for the adult to sign up for themselves, and the children are added at a later point in the application. So it kind of works on a pre-populating, whatever that's called, algorithm. And so if you make the account in your kid's name, it's going to fill your kid in as the head of household, and then it makes everything not quite line up. But if that happens, you can always contact TennCare Connect or your DID regional office, and they will help you figure out how to fix that. But so after you have applied on TennCare Connect, you log back in and link your case, and that allows you to have talking, you know, in the networks between everything that you put in there and everything that TennCare is going to mail to you. And you can also choose to get your letters and email and get text message alerts and things like that. And then you'll start to see a chart that will allow you to populate all of the documents that are required. And at that point, the case is sent over to DIDD, and you're lined up with a case manager, and they contact you to set up a time for an assessment. They call you and they set up an assessment. Some people get a video call as well. Some people don't. They're still working on uploading medical documentation. Some people, this has proved to be a challenge for the system. There's a very small storage space for each file upload is only 5 megabytes. So that's not a lot when you're looking at medical records or families with many household members. So that's been a challenge for them. They've made some workarounds with, you know, emailing records directly to case managers, and unfortunately, like one-on-one fixes by calling TennCare Connect. And then the next step is figuring out if the child meets the eligibility for Part B. That is the kind of goal of the application process, is to figure out if you're eligible for Part B. So you can flag, quote unquote, for the Part A process, but you can also request to be evaluated for Part A. We do have some concerns that not everybody who might belong in that Part A evaluation will get there. So please know that you can ask for a Part A evaluation, even if you're told that you don't qualify for it. And then the next step after that, if you do qualify for Part A, is a completely different medical review. And that's done by a third party called Ascend. And that's where some additional steps come into play. But eventually you end up with these lovely support plans that we've been referring to. Next step. I think we likely have confused you a million different ways. So I'd like to know what kind of questions we have coming in here. I tried to answer some before.
Yeah. there's a few that have come in. So does the assessment determine which part A or B or C a child qualifies, or do you apply for a specific one? So that was sort of answered in the previous slide. When DID calls to do the assessment, they are initially looking at every child for enrollment in Part B, and then if the child has exceptional needs, then it will move into the Part A review, and ASCEND, along with a doctor, will be part of reviewing those applications for Part A. But it is worth noting, I think that's a good point to bring up, Sarah, that if you feel like your child should be enrolled in Part A, you should voice that at the initial assessment, and make sure that the DID assessor knows that you're looking for Part A approval. Do you have any other points to make on that? Oh, in Part C, I saw in some of your chat communications, Part C is technically just like a sort of transitional Medicaid. So it's not, the only benefit that comes along with it is the continuation of Medicaid coverage. So it's not like the assessment will be assessing specifically for Part C, because the only way to be enrolled in Part C is if there's no slots open in Part A. And I mean, do you have anything to say about that, Sarah?
No, I think people just need to understand that those people are already coming from a Medicaid product. So there won't be any, number of slots for that category or anything like that.
Great. Next question is, so do parents, so there is a payment parents have to make monthly?
Correct. Everyone is required to pay a Part A premium for the joy of receiving Medicaid coverage for their child in Part A. As I said, it is going to be offset by the child's portion of your private insurance plan, which you're also required to have. There is a hardship exception for individuals when they first apply, but it's only if you don't have insurance, private insurance available to you. And there's some possibilities if your insurance is like, I saw some footnotes about cases where it was extremely high, and that they might be willing to pay a portion of that versus enroll the child in Medicaid, because that would be, more advantageous for the state.
Great. So did you say that you can only apply for the hardship if you don't have private insurance, or you can?
Correct.
Okay.
It's only available upon enrollment, and it's only available if you don't have insurance.
Got it. Next question, regarding Part A. Will the TennCare portion cover the deductibles and out-of-pocket expenses for the primary insurance plan? So I'm guessing this means will they be able to use any of the TennCare coverage to cover the cost of the private insurance that they'd be required to have?
As long as they are TennCare providers, they will pay your copays and your deductible for your private plan.
Great.
How it works.
Right. What is the estimated number of children who would qualify for Part A in the state? So that's there's 300 slots available for Part A.
They came out with that was sort of came out during the bill development, was that there were approximately 3,000 children in the state that probably needed this type of service. They kind of broke that down into kind of arbitrarily, honestly, into how many they thought might be, significant need versus a bit less significant need. So that's how they got the 300 and 2,700 split. And that's how they thought that they could, best use the amount of funding that they were allocated and serve the most medically complex and disabled kiddos.
Great. And how many will be in Part C because they're waiting to be in Part A?
Yeah, I feel like that's just still really confusing for people. There will be no limit to how many people can be in Part C because that's just a transitional Medicaid group. So they were already receiving Medicaid, but something happened. Maybe their parents got a raise, or maybe they were able to take on more hours because now they're not afraid to make a little bit more money now that Katie Beckett is around. So as long as they're, going to qualify for a Part A slot, then they would be put in Part C, which is a transitional Medicaid spot, until a Part A spot opens up for them. For this first year, it's only going to be Tier 1 that's available for Part A.
Yeah, so I did also want to say again that if you are receiving transitional Medicaid because you're in that Part C section, and a Part A slot does open up, you are required to move into the Part A slot. You can't choose to stay only in Part C. And sometimes, staying in Part C might be desirable to some families because in Part A, you have to have private insurance, and there's the possibility of having to pay a premium.
Yes.
And so, but you will be required if a slot A, if a spot in slot A opens up, you have to move into that slot.
Right. Somebody else was asking about, they were saying that they were in spend down currently. So unless you would need to become ineligible for spend down in order to then be able to apply and qualify for Katie Beckett. Otherwise, you're still a Medicaid qualified child. So they're going to reject your application because you're already receiving Medicaid.
Is the Katie Beckett application in the same place as the TennCare or Medicaid application?
It sure is. You are essentially applying for Medicaid, and then after you have input the children in the household, there is a section that allows a box to pop up for Katie Beckett, and you assign it to a child, and then it allows you to upload the documents there next to that child.
So we have some additional questions about what that specifically looks like. Do you know is there like a box that you check that says you're interested in Katie Beckett, or?
Yes, it's like a little section. It comes up, you have to mark yes or no.
Okay. And when did that start showing up? Do you know, was it?
On the 23rd at 7 a.m.
Okay. So if you'd been looking at the Medicaid application before that, you might have not seen it, but
yes, if you submitted before then, or you were, you had to, you couldn't be far enough into the application before that date, or it wouldn't appear for you. So some people had filled it out all the way to the end and just waited till that morning to hit submit, and they didn't have that section. You had to be, not quite that far into the application. But now, if you're starting a new application, it's automatically in there.
Got it. Also, how does Part C differ from TennCare Standard?
Well, just that it's transitional. It's meant to be temporary because it's awarded to people who have lost, it's just a kind of like a step down, like you're getting kicked out, but here we're going to give you a couple extra months until then. But in this case, they're letting you stay there until you get a Part A spot.
Great. can we just remind people, what is the age limit for people in this program?
It's for children under age 18. You have about a sort of 12-month window at the 18th birthday, if there is an SSI application pending. But otherwise, you need to be under 18.
And I'm not sure if you know the answer to this. Would an ACA plan count as private insurance for Part A?
It sure does. Basically, they just want minimum essential coverage. That's what they're asking for. So any plan on the ACA would hit that mark. Employer coverage, anything you've purchased privately.
Someone asked, so just to clarify, if a child has never had TennCare, can they qualify for Part C if there are no Part A slots?
No.
No.
Part C is for people who are currently on Medicaid. They currently have TennCare, but they're getting kicked off because they have had an increase in income or resources.
Right. So in that case, yeah. So in that case, a child who would qualify for Part A, but there are no open slots, but they've never had Medicaid before, they would be enrolled into Part B while they're waiting for a Part A slot to open up. Is what the literature that I've seen so far says. So the Part B, they would get $10,000 of home and community-based wraparound services, but not full Medicaid while they're waiting for that Part A slot to open up.
I do want to clarify that part a little bit. So sure. They're going to get up to $10,000 or $15,000. Right. There is no a child is not entitled to get up to the cap. They really are only required to do what is medically necessary. And again, it needs to be laid out in that support plan. I feel like that was sold a little bit different, and people feel like that's just a pot of money and you can use it as however you want. And it actually comes with a bit more strings than that.
Sure. And I will say that for other programs like the Choices program and the ECF Choices program, we've seen it sort of, the program sort of hinges on how good of a care coordinator you have. So the person who's either the nurse, I forget the specific name for it, but the
nurse care manager.
Yeah, the nurse care manager versus the DID care manager. It's sort of the type of care and how well the sort of program works for you really relies on having a good person in that role. And so I assume that it'll be the same in Katie Beckett. Making sure that you have a good communication and connection with the care coordinator is going to be key in making sure that the program works best for the child.
Definitely. And I encourage everyone to just keep asking questions. And even if you think it's something that they did purposefully or was an intentional design feature, don't be afraid to question it, because when enough people do that, they can make a change, or, will come out as, hey, this is something we need to look at. Maybe that's not working out exactly as we planned. I know that we're getting a lot of feedback about the requirement to have 6 therapies per week during a pandemic. So something might come of that if enough people, report that that's an issue.
We have a few more minutes maybe to answer a few more questions. I wanted to bring up, so I saw that it was sort of answered previously, but are undocumented children eligible for Katie Beckett?
Yeah, so anyone who's going to get a TennCare product needs to have a social security number.
Right. And a follow-up question to that. So children who have a social security number, but have undocumented parents with no health insurance, would they qualify?
I don't.
Do we know that? Yeah, we might not. Yeah.
I don't know that. That would probably have to be a special application. because of that situation, but I don't know why that would disqualify a child.
Yeah.
You know, I think they would have to apply in a special way. I don't think the TennCare Connect is set up for that. But having read the regulation, I don't know why your parents not having a social security number would disbar you from having one.
So the last question that we'll be able to answer probably live, and the rest of them, like I said, we'll try to get to in a follow-up email. Any advice about what documents parents should have ready when applying, or a good way to sort of prepare before the application process starts?
Yeah, I feel like a lot of parents maybe drove themselves a little crazy with this, or maybe spent more time than they needed to, unfortunately. They're really just looking for the last 12 months. So I would look at your therapy reports, your IEP, your doctor's visit checkout notes, any specialty clinic, you know, checkouts that you go to, any assessments you've had or surgery notes, anything like that. The IQ reports are the only thing that are permitted to be longer than 12 months. That can be up to 3 years old.
Great. All right. I'm showing it at 12 o'clock here. So I want to be respectful of everybody's time, and again, want to thank you all for tuning in. Again, just as a reminder, this is a brand new program that we're all still learning about and you know, experiencing for the first time. So we want to hear back from you all with any issues or barriers that you run into as you're applying for the program or interacting with the program. Those would be helpful for us to know, either Sarah at Family Voices or myself at the Tennessee Justice Center. And we will look forward to hearing that feedback. We feel like together as a community, we are able to you know, get a better idea of what's going on and how these programs can be improved, and how we can work through them the best way we can. So we thank you again for joining us today, and hope you have a great rest of your Tuesday. Thank you.
Bye-bye.